I am from Nassau County, Florida, a small community called O'Neill, Florida, which is just outside of Fernandina Beach. And I feel that, since I was a little kid, I've always had a predilection for being interested in birth and families and kids.
Growing up, she didn't see a lot of physicians that actually looked like her, and so she wanted to become a physician to give back to her community.
So it's super rewarding to take care of, teammates on my basketball team and, their kids and their grandparents. So that's really rewarding. My husband is my best friend. We have been together since we were kids, 15 years old. We were both star basketball players at opposing middle schools.
The girls normally play before the boys, and I was watching the girls' game, and I said, who is this girl who's scoring all these points? And I was like, man, I gotta meet her.
A career in medicine, being a mom, being a wife, is not without challenge. So being rooted in purpose and grounded in faith definitely has helped me to sustain my purpose and allows me to fully use the tools that God gave me to walk into my calling.
That's part of her upbringing, part of her faith, praying family. At night she prays for her patients, and then when she gets in, she prays with her patients.
My specialty is very intimate. It involves very close details that someone may keep guarded with their heart. So being able to enlist trust and being able to accurately communicate with patients, both culturally and spiritually, is very important and can be a game changer in the relationship that you have with the patient.
She's really passionate about teaching. She just has a way of connecting, and she has a way of making everybody feel important.
Working at the University of Florida, I have the opportunity to be an educator in the lives of both medical students and medical residents. I think that training the future leaders in healthcare is one of the greatest honors of my life because it's going to affect generations to come. Dr. Leon Haley was a former mentor of mine. He shared that he was very proud of the clinical work that I've done, but he also challenged me to use the skills, those skills that God gave me, to reach more patients. So being an advocate in the community, becoming more involved in healthcare leadership to affect greater decisions for healthcare systems has really become a focus of mine. When I want to relax and chill and take a breath, I literally disconnect from technology, even from my family. I always tell everyone you can't pour from an empty cup. So if I'm touched out and overstimulated and consistently on that hamster's wheel, I feel that sometimes disconnection, even for a short time, even for 30 minutes a day or an hour or a weekend, that solitude allows you to reflect on your purpose and recharge. I'm all about structure and routine. So before I go to bed, I do have a cup of coffee. But the reason I have my coffee every night in my same mug goes back to my family and it goes back to my grandmother. And every night before her and my granddaddy went to bed, they have a cup of coffee. It brings a sense of peace and calmness and a sense of nostalgia. And as I've gotten older and a lot of those family members aren't here with me anymore, I can be very reflective every single day, be very grateful in that very small moment.